Healthcare is changing. It's progressing. Never before have we had the opportunity to leverage technology the way we do today, leveraging artificial intelligence to amplify authentic intelligence, not replace it. More and more folks are demanding personalized, accessible care that's built around their lives. Human performance care shouldn't be any different. That's why we've created the Shoulder Guy, the Concierge Performance System, a member-based system that helps folks protect, then perform, becoming bulletproof through personalized guidance, greater accessibility, and proprietary technology designed to amplify, not replace expert care, all in less time at a fraction of the cost. For over 2.5 decades, I've wrestled with this reality. Why do so many folks continue to struggle with the same physical problems despite receiving what they perceive to be top-notch care? Sure, many experience symptom relief, but all too often, those symptoms return. Or they rear their ugly heads somewhere else. Not because the body's failing, but because it's surviving. It's doing what it's supposed to do. It's compensating. Now, over the years, I've come to realize this isn't a reflection of a lack of effort or good intentions, but rather we as healthcare providers are often restricted by 3 realities: time, access, and affordability. And that's precisely why the Shoulder Guy, this concierge performance system, was created. Now, first, before we jump into this, I got to share this with you. The performance hygiene model. Everyone understands dental care. Brush your teeth, floss your teeth, see your dentist. Simple. Yet those 3 simple habits, they've helped billions of people maintain their dental health. Yet this human performance, it follows a remarkably similar pattern. Step 1, the UVU. It's the toothbrush of human posture and performance. Just as brushing your teeth can be performed multiple times throughout the course of the day, the same is true of posture brushing. Simple, accessible, affordable. The goal is to give folks a practical tool to help maintain and improve posture, movement quality, and performance. A tool they could use anywhere, anytime. Step 2, the bulletproof circuit. This is the flossing, so to speak, of human performance. The bulletproof circuit combines targeted neuromuscular stimulation, guided movement, and strategic loading into a simple process designed to help restore function and reinforce better movement patterns. The entire system was engineered around a simple objective: help folks perform more meaningful neuromuscular work in less time. Which leads to the first breakthrough: 75% less time. What may traditionally require more than an hour of one-on-one expert care can often be achieved with about 15 minutes utilizing the bulletproof circuit. The second breakthrough: unmatched accessibility. The healthcare industry, appointment dependent, whereas the bulletproof circuit is accessibility dependent. Members have access to the bulletproof circuit 6 a.m. to midnight, 7 days a week. That's 126 hours of access week after week. Additionally, members have access to doctor-directed bulletproof circuit sessions, Monday through Thursday, 2 p.m. to 6 p.m. These doctor-directed sessions provide guidance and coaching. Think of these sessions as the training wheels. Once members become comfortable with the process, they can continue utilizing the technology whenever it fits their schedules. Traditional care often requires folks to rearrange their lives around appointments. The bulletproof circuit, it was designed to do the opposite. Early morning, before work, during lunch, after work, before dinner, whenever it works, because accessibility creates convenience. Convenience creates consistency, and consistency creates results. The goal is to make meaningful neuromuscular work practical enough to fit seamlessly into busy lives. The third breakthrough: affordability. Now, there's times when there's no getting around it. That one-on-one direct expert care, it's imperative. But listen to this. If someone required the equivalent of 1 hour expert care 3 times a week, that'd be $600 a week, right? A little over $2,500 a month. For most folks, sustaining that level of expert care month after month, it's not going to happen. It's not realistic. And folks ration care. It's human nature. They wait until symptoms become bad enough, seek relief, life gets busy, the underlying dysfunctional protective patterns remain. Symptoms return, and the cycle repeats. The bulletproof circuit, it was engineered to disrupt that cycle. For a $250 monthly membership, folks receive better at 90% less cost and 75% less time and greater access. For the first time, meaningful change becomes practical. This is concierge performance care. And lastly, step 3, the shoulder guy. Just as brushing and flossing don't replace the dentist, the UVU and the bulletproof circuit, don't replace expert care. Sometimes folks need expert evaluation. Sometimes they need guidance. Sometimes they need more in-depth intervention. The difference is that expert care isn't the entire system. It's a part. The system empowers folks to do more of the actual work required to protect, then perform. The choice. The rehab and performance industry, by and large, is handcuffed by this reactive model. Regardless of intent, it often boils down to how do we manage symptoms once they appear. The concierge performance system is aggressively yet responsibly turning that model upside down. What if we made the work required to improve function accessible, affordable, and convenient enough that folks could perform it consistently? What if folks didn't have to wait until something hurt? What if they didn't have to ration care? What if they had the opportunity to actually turn the clock back, not merely masking symptoms, not settling for temporary relief, but restoring their God-given ability to protect, then perform? This is the real breakthrough. Every day, people lose the ability to do the things that they love. Throw, hit, train, work, play with their kids and grandkids. Those abilities are worth protecting. The shoulder guy isn't simply a provider, it's a concierge performance system. A system designed to help folks protect, then perform. Become bulletproof in less time, with greater access, at a fraction of the cost. In closing, every person has a story. Everyone has something they're either trying to get to or back to. If you'd like to explore whether this system might be right for you, I'd love the opportunity to connect, to listen, and to see if I can help. I'm Doc Miller, the Shoulder Guy.